Good morning.
How are you?
All right, and yourself?
I am well. It feels like a long, long time. I guess with so much stuff going on, it
Yeah,
makes it feel like a long, long time. How are you? How are
I'm
things?
good. Great, thank you. And yourself?
Yes, I'm sleeping in a mug, but we here. We're here. We're here. Ah, I went. There was a line dance party, and I've been trying to convince my classes to come out. Come on, y'all got to plug in. Y'all done learned the steps. Y'all know the stuff. Come on. So I finally got a group to come on. I got a table. They came, and a time was had by all.
Good.
I love their energy. They were amazing. This one lady, she didn't care who she stepped on. She was just out there. I said, she about to kick somebody in the ankle. She didn't care. She had a ball. And I loved it. I love that for her. Oh, but other than that, I'm good. I got a very, very busy morning. So we won't have the meeting after the meeting. Um, I have a funeral. I have an end of the year gathering with one of the boards I sit on. I have a meet and greet. I have there's something else I'm probably missing, but I think it's something else in between there. And then we have the Greek festival here where I meet my belly dance sisters annually, and so we go to the Greek festival and act a fool. So
Okay.
I'm sleepy just thinking about it. I'm gonna need a nap somewhere. All right, so I won't look. I feel like those preachers. I won't be before you for a long time, but we're gonna be here for a good time. How about
There
that?
you go.
So, good morning, everyone, and welcome to our Saturday morning tea. Here we brew up the hottest topics in healthcare. We discuss health information, news, education, folks kicking folks in the ankles and having a good time and showing out. Our week, the week ahead, all of the things, certification tips, entrepreneurship, and really just the revenue cycle at large. So as you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner. I am the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, let me ask you, do you know what it takes to be a certified marketable medical coder? Well, before I introduce my co host, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey, all right. I should put a line dance to that music. If you're interested in getting more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. So joining me today is my partner in success, my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a long time. I left the bedside in 2014 and transitioned into HIM during the pandemic. In 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
Mm-hmm. And how's that going?
It's coming along.
Good, good. I'm so happy for you. All of the things, all of the wonderful things that you have going on. I'm so happy for you. All right. So before we jump in, let me remind you that you can join in and add to the conversation. So don't be shy. Your opinion matters and is always welcomed here. So, friends, just use the chat, chat away, chat away. You might chat with us, chat amongst yourselves, all of the things. But if you have a question, please type Q first so we know that it is a question for us and we don't miss it. So, for those who are just joining us or watching the replay, today we are talking about the OIG report, $16 billion fraud findings. Every revenue cycle manager or professional, every revenue cycle management professional must know, should know, better know, need to know, just be in the know, all of the things. But first, let's get into our church announcements, shall we? Got you. Johnny on the spot. Love it. Got the double snap instead of the clap. Look out. Hey. Hey. Maybe we found somebody to do it. All right, let's see. I don't really have too many church announcements or any church announcement in particular. I went to a couple of AHIMA events over the past week. They had their leadership symposium. So get ready, y'all. They're about to drop a whole bunch of stuff. That's all I got. And secondly, I joined the Education Connect, and I know I'm butchering the name of it, but the Education Connect with AHIMA with Dr. Jasmine. Excellent presenters and presentation. And let me just say, I loved the visual. The visual was everything I needed to see. All throughout the entire week, there was some different types of visuals, but that education visual, baby, when I said they came with. They were standing on business. It was beautiful. I loved every second of it. Trust and believe there's some other wonderful tidbits coming out as far as AHIMA education, credentials, micro credentials, all the things. So we've been talking about some things that AHIMA needs to do and step up. And I don't know if they've just been listening to us, but I think they've been listening to their members at large, and things are moving and shaking over there. The other thing is, and I just wanted to ask you, so next week is the holiday. Are we working or not?
Well, 4th of July. I'm like, what?
It's up to you. I'm cool either way.
No.
Okay. So we won't be here next week. Do you have any announcements?
No, I don't.
Okay. All right. Well, let's get on with it. Let's see who we got in the house today so far. Hi, Tasha. Good morning. Good morning to our on the street correspondent, the Crafty Coder. Belly dancing? I definitely need more content on that. Absolutely. We'll share in the meeting after the meeting in 2 weeks. Look, I was like, wait a minute, in 2 weeks. Oh, and for those who are in the meeting after the meeting, I think there's some accountability things that need to be ticked off. And we're probably a couple weeks late. So y'all should be ready in 2 weeks. So be ready. I'm bringing y'all to the stage. All right. So let the tea spilling begin. Again, welcome to our Saturday morning tea. I am Clarice Warner, the girl with the pearls, with my partner in success, the coding nurse. And really, I hope you have your favorite tea brewing or whatever beverage you have of choice. I think I'm a barista over here. I made my little
Uh-oh.
I made my lavender, what is it? Lavender oat milk matcha latte. I guess that's what it's called.
Uh-oh.
Yeah, I think I'm a barista over here. I've been drinking them. I went to the store to get theirs and was like, I could do that. And so here we are. I got the little whisk thing and making the cold foam. I'm doing all the things. Y'all know I think I could do everything, right? Wait a minute. She said, I'm so glad I'm on the sidelines looking in. Ma'am, you had your moment. You did completion. But there's something else I think you need to complete. So you ain't really truly on the sidelines, right? Right. Yes, but she says she's on the sidelines, rooting for accountability and not in the hot seat. No, you got a hot seat moment, unless you've completed. But we'll talk about it. All right. So today we're going to unpack just this report was off the chain. I don't it's linked in the description. If you get an opportunity to go through it, if it's too much, because some people just be like, it's too much, I can't read it. Let your AI friend summarize it for you. They can give you all of the details, but there's a lot going on in the world today, as we all know. So this is kind of information from the latest semi-annual report from Health and Human Services Office of Inspector General. So I've been in this industry a long time, and long enough to know that when the OIG releases their findings, everybody needs to be paying attention and listening and tuning in to find out what's right, what's wrong, and what could be indifferent. So this report, again, is crazy. $16.61 billion. Billion. Oh my God. In total monetary impact during just 6 months. This is just 6 months. October 2024 to March 2025. 6 months. But here's the big thing. The OIG is delivering an incredible $11 return for every $1 invested in their oversight work. And we talked about a couple of weeks where they're about to even get more jiggy with some of their enforcement around risk adjustment. And I've been seeing the buzz. Did we talk about it first? I don't know, but I've been seeing the buzz ever since we said something. Everybody's wanting everybody to get their risk adjustment stuff together, get it together, jump in on this wave. But anyway, every dollar spent on investigations and audits is saving us $11 in fraud, waste, and abuse. So that's the kind of ROI we all dream about in our revenue cycle work. But the numbers are staggering. There were 946 investigations closed. They're not playing. 78 reports were issued, and 1,503 bad actors were excluded from federal health care programs. That means that 1,503 individuals and entities can no longer receive a single penny from Medicare, Medicaid, or any other federal program. They're done, finished, out of the game permanently. Most folks don't think about that. You're going to have to transition your whole life playing the games. But anyway, so this report organizes findings around 5 critical areas that touch every aspect of our daily work: public health challenges, financial integrity issues, Medicare and Medicaid oversight, beneficiary safety concerns, and data security vulnerabilities. What's fascinating is how interconnected these areas are. A cyber security breach can lead to fraud, which impacts beneficiary safety, which undermines public health. It's all connected. So let's start with something that should have every revenue cycle professional sitting up and taking notice. And Mr. Jesse, you know the drill. Jump in, whatever. Medicare Advantage risk adjustment payment. The OIG found that diagnoses reported only on health risk assessments, and related chart reviews generated $7.5 billion in risk adjusted payments in 2023 alone. Now get this, $4.2 billion of that came specifically from in-home health risk assessments. Here's why that matters. These aren't diagnoses from regular physician visits or hospital stays. These are diagnoses generated specifically through targeted assessment programs, often conducted in patients' homes. The OIG is questioning whether these diagnoses are valid and whether patients are actually receiving the coordinated care that justifies these higher payments. Now, I've, y'all know I play in the playground with a lot of seniors. And that's all they talked about, at least last year. Why are these insurance people calling me talking about they wanna come to my house? Why is the nurse saying she needs to see me at my house? It's mind-boggling, and I didn't know this type of money was involved with those services. And the viability of this practice, as well as whether or not it is, uh, something that will assist in those risk adjustment, dollars will is I guess we'll see and determine, or once it's determined whether or not that is the case, we will definitely see whether or not those types of services will continue. Mr. Jesse, did you wanna?
You know, we've been talking about risk adjustment since we started this, since I joined your
Mhm,
platform. And it's like we say all the time, it could all be so simple, but people don't
mhm,
want to follow the rules and they think they can do whatever. And it's a never ending back and forth.
mm-mm, mm-mm. It's crazy. So, think about what this means for your organization. If you're working with Medicare Advantage plans, you need to understand that every diagnosis code you submit is under intense scrutiny. The days of document everything and hope for the best are over. We need clinical integrity behind every code, every single code. And we need to ensure that documented conditions are being actively managed and treated. The OIG specifically called out that inaccurate diagnoses from these in-home assessments may have resulted in improper payments. That's Inspector General speak for, we think there's fraud happening here. As coding and billing professionals, we have a responsibility to ensure that every diagnosis we report reflects actual patient care and clinical reality. That one's gonna be that's gonna be crazy, especially with all of this now focus and intense scrutiny on risk adjustment. Mm-mm-mm. Hope for the best. Yes, a lot of those HRA diagnoses are incorrect. Yes, 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 yes. Good morning, Vicky. Welcome. Yeah, it's gonna be off the chain. We gonna see. It's gonna be a ride. So let's also talk about improper payments as a whole, because the numbers are absolutely staggering here as well. We're seeing systemic failures across multiple programs, and the dollar amounts should make every compliance officer break out in a cold sweat. First, Medicare Part D improperly paid an estimated $465 million for drugs that should have been covered under Medicare Part A, skilled nursing facility benefits. This is a basic coverage determination error that's costing taxpayers nearly $500 million. If your organization works with SNFs or Part D plans, you need robust systems to determine the correct coverage source. Also, Medicare potentially paid $454 million in improper payments for COVID-19 tests that exceeded the monthly limit of 8 tests per enrollee. We're talking about 39 million tests that shouldn't been paid. This tells me that edit systems and quantity limitations aren't working properly across the board. Third, Medicare improperly paid acute care hospitals an estimated $190 million over 5 years for outpatient services provided to hospice enrollees. These services should have been provided directly by hospices or under arrangement. This is a coordination of benefits issue that's been flying under the radar for years. But then here's the kicker. Medicare also improperly paid an estimated $35 million for catheters and related supplies, with enrollees responsible for nearly $9 million in associated coinsurance. Not only is the government losing money, but patients are paying out of pocket for improper claims. So what does this mean for you? Your claims editing systems, your prior authorization processes, your coordination of benefits procedures, they all need to be checked and bulletproof. Because if the OIG can identify these patterns in their audits, CMS can implement prepayment edits to stop these payments before they go out the door. Let's see. Let's also talk about something that's, again, absolutely mind-boggling to this drug spending that's literally breaking government budgets. Medicaid spending on diabetes and weight loss drugs increased by 540% from 2019 to 2023, reaching over $9 billion. And if this trend continues, we could see $29 billion in Medicaid spending on these drugs alone by 2026. Medicare Part D isn't any better. Spending on diabetes drugs increased by 364% in the same period, reaching $35.8 billion in 2023. If that trajectory continues, we're looking at over $102 billion in Medicare Part D spending on diabetes drugs by 2026. Now, I want to be clear. I'm not saying these medications aren't necessary or valuable. Many of these drugs are life-changing for patients with diabetes and obesity. But from a program integrity perspective, we need to ask some hard questions. First, are all these prescriptions medically necessary? And are we seeing appropriate prior authorization and step therapy protocols? Second, are we seeing proper coordination between Medicare and Medicaid to avoid duplicate coverage? And third, are pharmacy benefit managers and plans implementing appropriate utilization management? And for those of you working in prior authorization, utilization review, or pharmacy benefits, this is your world all day, every day. The OIG is clearly signaling that drug spending is a priority area for future audits and investigations. So your documentation better be impeccable. Your medical necessity determinations better be evidence-based, and your appeals processes also need to be bulletproof. And then this isn't just about saving money. It's about ensuring that these incredibly expensive medications are going to the patients who truly need them and will benefit from them. Mr. Jesse, you want to jump in?
You know, one of the areas that you don't really see a lot of opportunity, and I know that people are involved in, is Medicare Part D. Every now and then I'll see an ad, a job posting, and they, not exclusively, but they mainly look for certified pharmacy technicians. And I wonder, like, could there be more opportunity, and how would somebody pivot into that? That'd be interesting.
Yep, especially checking and in this denials piece. I mean, it seems like there's some opportunity for somebody to dibble and dabble and put their toe in there.
And I only bring that up because also there's a part of risk adjustment. They're called like RxACCs, which are about prescriptions. And I have never,
Medicaid.
so but it's kind of, I've always thought it was kind of tricky because when it comes to medicine, well, and I believed it for years. I believe that when a medication is prescribed, it should be documented why.
Mm-hmm.
Like you're prescribing a torvastatin for,
Mm-hmm.
not just not just look for a diagnosis and uh, a certain medication, because all the time certain things are not used the way people think that they're used.
Mm-hmm.
You have people like, for instance, like spironolactone. You have some people who use it for hypertension, and you have some people who use it as a testosterone blocker.
Mm-hmm.
So what is the reason a person's on it? Just because you see a medication listed, you can't assume what it's for.
Yes. And
And I
somewhere in that documentation, that should be there.
should be.
Mm. Mm. Well, let's see. Here's something that might not get headlines, but should terrify every state Medicaid program. 12 out of 13 states audited by the OIG underreported their federal share of Medicaid collections by a net $61.8 million. They literally didn't return money to the federal government that they were legally required to return. This happened because states didn't use the correct federal medical assistance percentage or made calculation errors. Now, if you're thinking that's just accounting mistakes, think again. The federal government provides matching funds to states based on specific formulas and percentages. Y'all already know how they operate. They tell you everything it is that they need you to do step by step, line by line. Whether folks follow it, whether folks read it, that usually is the question. Folks want to put their own interpretation on things. Sometimes that's not the way to go either. Anyway, when states collect money, whether from a state recovery, third-party liability, or other sources, they have to return the federal share. When states don't return the correct amount, it affects the entire Medicaid program's sustainability. It means less money available for actual patient care and program improvements. And from an audit perspective, it shows that basic financial controls and oversight mechanisms aren't working. So if you work for a state Medicaid program or a contractor that helps states with financial reporting, this finding should be a wake-up call for you. Your reconciliation processes, your calculation methodologies, your quality review procedures, they all need to be rock solid. And the OIG is clearly looking at state level compliance more closely. And if your state is one that's not properly calculating and returning federal shares, you can expect an audit visit in the near future. Now let's talk about something that keeps probably all of us up at night: cybersecurity vulnerabilities in healthcare systems. The OIG found that 8 HHS operating divisions lack adequate cybersecurity protections, with 19 active threats identified during their audit and 138 vulnerabilities related to required security controls. Here's what really concerns or should concern us all. This audit found that it would likely take only a moderate level of sophistication for an attacker to compromise the organ procurement and transplantation network system and cause significant harm. We're talking about the system that manages organ allocation and transplantation across the entire country. But it's not just the high-profile systems. The Office of Civil Rights HIPAA audit program was found to be too narrowly scoped to effectively assess electronic protected health information safeguards. That means the very office responsible for enforcing HIPAA compliance doesn't have adequate tools to ensure healthcare organizations are protecting patient data. For those of you working in health information management, compliance, or IT, this should be also a wake-up call for you. Your risk assessments, your security awareness training, your incident response procedures, your vendor management programs, they all need to be comprehensive and regularly updated. We also saw enforcement actions during this period, including a lab technician who was excluded for 27 years and sentenced to 84 months in prison for using stolen patient information to submit false COVID-19 testing claims. Again, this isn't theoretical. People are going to prison for healthcare data breaches and fraud. So the bottom line is this: if HHS operating divisions are struggling with cybersecurity, what does that say about smaller healthcare organizations with limited IT resources? We all need to step up our game. Let's talk about enforcement actions again, because the OIG isn't just identifying problems. They're putting people in prison for decades and recovering billions of dollars. The cases from this reporting period should serve as warning to anyone thinking about cutting corners or engaging in fraudulent activities. And let me just say this as an aside, because I'm hearing all kinds of folks putting their heads together, trying to do all kinds of things. Please find somebody in compliance. Please talk to some healthcare attorney at a bare minimum. Please talk to somebody in revenue cycle who knows something about billing and claims submission. Please talk to somebody who is certified in coding, who can assist you with the proper documentation and the codes, because folks out here wilding out. They hear that there may be opportunities and money and all of the things, and like, oh, well, we could just do this, and if we do this, and we could get this, and you can all get some orange jumpsuits and go to jail. For real. It's real out here. You can't do that. And while initially it may be all rainbows and bunnies and unicorns and all the things, because the money is flowing and everybody's happy, they will come back and audit. They will come back and take a look, and they will recover what they gave you and then some. Don't play with the government's money. I'm gonna step off my soapbox right there. Mr. Jesse, you want to say anything?
I think that people lose track of how long the government can come back.
Long time. They're not playing with y'all. So what may seem easy and sound good and what, ask somebody, please get your facts, get the documentation. Again, we've said it over and over and over again. It could all be so simple if you talk to somebody who is an expert in these areas.
Well,
I can walk you through and show you black and white in writing, step by step, what it takes to do all of the things that you want to do. And if you can't do all of those things, you can't do it. Don't do it. Don't play.
But the problem is not even, well, it's what I have just come to the realization that there is two things. There's no respect for coding knowledge in healthcare and in the revenue cycle. And also there are people in coding who don't speak up. Because there are a lot of people who know that you aren't supposed to do certain things, but if that's what the doctor tells them to do, they do it. And I've said this before, and I really think that the OIG needs to start doing like healthcare does. If you are a nurse and you're doing something that's not right, they suspend or take your license. I think that coders and billers should lose their certifications, because it has got to stop somewhere. And you have people who I can speak personally. You have people who don't listen. There are people who tell these organizations, oh, you can't do this, you can't do that, or that's not compliant. But they end up like railroading those people and forcing them out of the organizations. So I just think that, and also what needs to happen is there needs to be way more whistleblowers than there are, because like I'm just like, we want to act like we don't know why this is going on, and we do.
I don't think that it's not necessarily folks are not whistleblowing. Remember, the government has to decide whether or not they take that case. And so if they don't take it, then oftentimes we won't hear about it. So people may be saying stuff and maybe, going out there, but to that point, get, get your evidence, have some documentation, have the stuff so you can show and prove and all of the things that make it an open and shut case, I guess, if you will. Because then they'll bite for it. Because again, they can say, you know what? No, we're gonna pass on that. Or they may just be like, we want something bigger. We're trying to build a bigger case. Like we've heard some things before and we've this, that, and the third. And so we don't hear. But you're right. Folks need to speak up and say, hey, things over here is not right. That's not right. So let's see. A home health operator was sentenced to 12 years in prison and ordered to pay nearly $100 million in restitution for her role in a fraud scheme. She was billing for services never provided and paying kickbacks for patient referrals. That's another game that I keep hearing swirling around. Patient referrals. Don't play them games. Oh my God, kickbacks all day. Anyway, 12 years in federal prison. That's longer than many violent criminals serve. A telemarketer got 15 years in prison. A telemarketer for his role in a $67 million Medicare fraud scheme involving unnecessary genetic testing. He was managing a call center that tricked physicians into ordering medically unnecessary tests, and those test results often weren't even sent to the doctor or used for patient care. We already talked about this. We talked about this one a couple of weeks ago, or maybe a month or so ago. The McKinsey and Company, the global consulting firm that agreed to pay $650 million to resolve allegations that they advised Purdue Pharma on strategies to, quote, turbocharge, end quote, OxyContin sales, including advice that led to fraudulent claim submission. This is the first time a management consulting firm has been held criminally responsible for advice that resulted in client crimes. So what does that mean for you? It means that, oh, I was just following orders, or I was just doing what the consultant recommended. It's not going to fly. That's not a defense. Every healthcare professional has a personal responsibility to ensure compliance with federal laws and regulations. Again, the OIG excluded 1,503 individuals and entities during the 6-month period. That's about 8 exclusions every single day. And these aren't just fines or settlements. Remember, these are career-ending, life-changing consequences. So, but how are you tricking the doctors? I needed the providers to be like, no, why? I remember years ago, I think it was one of my first jobs out of high school. Well, my first job was a telemarketer job. So it was one of those first jobs out of high school. And we worked with this medical supply company. This company, I don't know if they're still in that book of business was not in business. But when I tell you it was a sweatshop for lift chairs, and what we were financially incentivized. We received salary, but we were financially incentivized to get so many lift chairs sent to the elderly who wanted them per month. And they used to have these blasts. Everybody used to be excited because they were like, oh, here come a blast, which was a commercial that they would send, they would show on TV during the times that people watching the judge shows and their stories and all of the things. And them phones would be lit because they wanted that chair. I need that chair. I can't get up. I can't this. I can't that. Da, 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 da. And we had a whole script and we had all the things that we had to tell them. And ultimately, it was the physician who had to sign off that the person needed it. So while you may have wanted it, we explained to them that it's your physician, da, 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 da. They have to write the prescription or requisition, all the things. So while we'll take your order, at the end of the day, it's based on your physician. We were sending that stuff to them physicians. They probably didn't even read it. They just signing stuff off, just signing off. Chairs going in. You get a chair. You get a chair. You get it. It was ridiculous. And one day, the feds walked in. Shut it down immediately. Everybody, you can go now. Everybody can go. Everybody can leave. We was like, well, what in the world is happening? I mean, cars outside, just all of the things. Shut it down. I'll never forget that. I said, ooh, what's happening? So I think the company is still in business, but that business is long. I think they've transferred ownership. I think dude went to jail. It was a mess. It was a whole mess. But yeah, I saw firsthand how easily things can be done through physicians who don't pay attention to their patients. They don't pay attention to what's really happening. And they just sign that stuff off like, oh yeah, they got some pain. Boom. No, sir or ma'am, you are attesting to the medically necessary reason for this. So just they got pain or just no, you need to really, and then but we had some who would push back like, absolutely not. Don't send these to me. And so we would have a list and tell the patients, if this your doctor, you're not gonna get a chair. Sorry. They don't do that. And so then they mad at the doctor and well, I'm gonna go find me another doctor. Hey, do what you gotta do, but you're not gonna get a chair through this doctor. But it was just crazy to see all of that. And that was 30-something years ago. It was a long time ago. Long time. But it was quite eye-opening for me to be at work one minute and have them shut the whole place down in the middle of the day. Right after, and we was pissed off because it was right after a spot. And so we was already like, we about to get our money. We about to get our bonuses. No, you're not. You better be glad you're walking out the door. How about that? So if they had a lot of money to be giving out bonus to us, imagine the amount of money that they was bringing in. And wow, it's a lot of money in healthcare. That's all. And everybody trying to get a little.
It is.
It's a lot of money in healthcare, but you got to do it the right way. You got to be complete about it. You got to follow the rules. It could all be so simple and lucrative. You just got to do it the right way, right?
That's right.
Golly. All right. So finally, let's talk about the hospital price transparency, because this one hits close to home for many of us working in revenue cycle. The OIG found that 46% of hospitals required to comply with price transparency rules simply said no. They're not doing it. Nearly half the hospitals that failed to comply didn't publish the comprehensive machine-readable files and didn't display shoppable services in a consumer-friendly manner. That's all they have to do. It could be also simple. Just tell people what it is what's going to cost them. Let them decide. They probably ain't got no choice because you might be the only game in town. So they're going to go anyway. But your job is to provide the your job is to provide information. I'm having discussions with a client of a client about making sure that the providers have the choice of evaluation and management codes. Ma'am and sir, you can't just put the high level codes in the face of the provider and tell them to pick one. No, you have to put them out. Whether they use the low, that's why it's a bell curve. Whether they use the low ones or not, they are part of the choice. You have to give them the choice based on the patient's presentation and their assessment. They need choices. You can't just be like leading them. Oh, well, here are the codes that we got. Pick one. It can all be so simple in the world today. Yeah. So again, you may think that price transparency is just a nice to have patient service, but you'll be wrong. Price transparency directly impacts patients' ability to make informed financial decisions about their care. It affects market competition and potentially drives down healthcare costs. So when hospitals don't comply, they're not just violating federal rules, they're undermining the entire healthcare market's ability to function efficiently. For those of you working in patient financial services, revenue cycle, or compliance, this finding should be a red flag. If your hospital isn't fully compliant with price transparency requirements, you're not just risking regulatory penalties, you're potentially facing OIG scrutiny. The report specifically mentions that CMS and others believe price transparency can increase market competition and drive down healthcare costs. Again, that means this isn't going away. It's going to get more stringent, not less. So if you're responsible for price transparency compliance at your organization, now is the time to do a comprehensive review of your current processes and ensure full compliance. So yeah, it's a lot of things going on in that OIG report. A couple things that you may want to ask yourself. How are these massive improper payment findings affecting your particular organization's approach to revenue cycle management, and what additional verification steps should you be implementing to ensure compliance? Another question you may want to ask yourself, with cybersecurity vulnerabilities found across multiple HHS divisions, what specific steps is your organization taking to protect patient data and ensure HIPAA compliance? Given that $7.5 billion in questionable Medicare Advantage risk adjustment payments were found, how should healthcare organizations balance aggressive documentation with clinical integrity? What red flags from these OIG enforcement actions should healthcare professionals be watching for in their own organizations to prevent becoming the next headline? You're like, you don't want to be that one. Okay. Well, and so those are just some food for thought and things to think about. Or if you're working in specific roles that impact or can be impacted by the information of the results of this report, y'all may have some conversations. Hopefully you're already having some conversations. You may have already seen this and have begun those conversations in your organizations to make sure that your stuff is tight. I mean, this is once again, if they haven't knocked on your door, they're telling you, these are the things that we're looking for. These are things that we're looking at. Get it together. It can all be so simple.
But what I would like to know is, because like we approach this, like when they talk about risk adjustment, they talk about all of this. What I am curious to know is, because like we come from it, we approach it from a coding standpoint. We have coding credentials.
Mm-hmm.
But I'm thinking about these entire CDI departments where a lot of people aren't coders. They just have CDI credentials, but they do all of this. Like they're supposed to validate HCCs and make sure that what gets coded gets coded. And it's like, I just because these kind of discussions, when I worked in inpatient CDI, they were never had. They never talked about the OI. They never talked about any of this.
Well, they may not have talked about it at that level. I'm sure somebody was talking at a higher level. I know.
No, but the level it needs to be talked about.
I mean, it needs to
people are doing
at some
the work.
point. It needs to trickle down to the people on the front lines. Absolutely, but I'm sure somebody is talking about it, and that too in itself can be a problem if the information is not getting to the people that really need to know. But you all as healthcare professionals in whatever career path you're in have a responsibility to make sure that you know what's going on. If you are in a particular area, like you said, they were looking at CDI, well, then you need to make sure you're up on CDI. Remember, this is a lifelong learning career and stuff changes all the time. Make sure that you are abreast of those changes, whether that organization is or not. You have some responsibility as well to make sure, just like with our coders, you have a responsibility to make sure you're on in the know on all of the changes that happen when you get new codes and all of the changes that happens with guidelines. That's part of the job. That's the cost of not being the boss, but that's part of the job. Whether somebody gives it to you or not, it's your responsibility too.
Well, it's not happening. I can tell you that. So.
Oh, all right, y'all. All right. So again, we've covered a lot today. A lot of things to think about. Unfortunately, you may not even be given the tools you need to succeed. And sometimes that may be on you. So let me leave you with a couple of thoughts about this particular report, that it isn't just a collection of statistics and enforcement actions. Again, it's a roadmap for the future of healthcare compliance and integrity. Every finding, every enforcement action, every recommendation is telling us something important about where the industry is headed. Again, it's kind of preparing you, helping you be proactive versus reactive. The organizations that will thrive are those that take these findings seriously and use them to strengthen their operations, improve their compliance programs, and better serve their patients. The organizations that will struggle are those that view these reports as someone else's problems. So here's my call to action for you today. Make sure that your leadership team knows about this. Say, hey, have you seen the OIG report? Maybe they don't know. Maybe they need to come and watch the Saturday morning TV. I don't know. Maybe they don't know. So share these findings with your compliance officers, your revenue cycle directors, your clinical leadership. Put this in their face, because again, they may be entrenched and busy with other things. Make sure everyone understands that compliance isn't just the compliance department's responsibility. It's everybody's responsibility. Second, conduct honest assessments of your own operations. Look at your risk adjustment processes, your claims editing systems, your cybersecurity controls, your vendor management programs. Where do you see gaps? Where could you be vulnerable? Invest in your team's education and development. We talk about this all the time. Make sure that folks have the tools. We just talked about this. Make sure folks have the tools they need to do the job that you hired them to do. Get with us. Check out the Saturday morning tea. We provide all kinds of information. Send them a video. Hey, had y'all heard about this? Had y'all seen about this? Let them know. We're part of the education. We can help as well. Also, join professional organizations, attend conferences. Knowledge is your best defense against fraud, waste, and abuse. And to Mr. Jesse's point, speak up when you see problems. The OIG hotline exists for a reason, and whistleblowers are protected by federal law. Your voice could prevent the next major fraud scheme and protect vulnerable patients, right? So remember that we are all in this together. Healthcare is a team sport, and when one organization fails, it affects all of us. So when one organization excels, it raises the bar for everyone. So let's keep that bar high. All righty. Yay. Anything else? Look, I'm right there on time. Look at God. Look at God. This was really good. Look, I'm gonna have to share this recipe with y'all. All right, let me get this in. Are you thirsty for fresh perspectives on the healthcare revenue cycle? By becoming one of the, oh wait, let me get this for her. They just heard money and went for it. Absolutely. See, people see that there's some money out there and it's possibly easy to get, and they just like, oh, well, let's just jump in. No, do your research. But anyway, thirsty for fresh perspectives on the healthcare revenue cycle? Well, by becoming one of the tea sippers, you'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. Why sip alone when you can steep in knowledge together? Come, let's spill the tea on industry insights. Here's what you can expect as a valued member of the tea sippers. exclusive healthcare insights. Gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Oh, and I owe y'all an article on some AI developments. Oh, Lord, it's going to be juicy. Make sure y'all check it out. Anyway, early access. Be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And my personal favorite, community connection. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network, LLC, a resource that empowers healthcare professionals like you to thrive in your roles, goals, and dreams. So thank you for considering becoming a member of the Tea Sippers. For the cost of 2 cups of regular tea a month, you can join the community. Check out the link in the description of the video. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. Yay. All right. Well, thank you all again for joining the Saturday morning tea or checking out the replay. Let me ask, was the tea spilled today? Did you walk away with something? Something. Put the teacups in the chat. Let us know. Remember, at the Saturday morning tea, we're all about building a community of savvy, informed, marketable healthcare professionals. So again, like, share, subscribe, and comment. Let's grow this community together. Mr. Jesse, do you have any closing thoughts?
No, this was a meaty topic. It's a lot of information, and
It is.
people just need to stay aware.
Well, look at you. Yes. Again, this has been a great session today. Tune in 2 weeks because it's the holiday, the other holiday. We'll be celebrating 2 for 1, huh? And so we won't be here next week, but we'll be here the following week discussing another hot healthcare information topic. And you won't want to miss it. For my tea sippers, you will, I'll be dropping things in there because I got all kinds of stuff that y'all need to know. So stay tuned. Again, thank you all for joining us. I hope you have a wonderful holiday. Be safe. Stay hydrated because it's so hot in the world today. Good Lord, stay hydrated. People, I've been talking to folks and they like, oh, I didn't feel good. People have been sick. It's just nasty. Stay hydrated. And so remember, be safe, be kind, and don't wish for it, work for it. Until next time, have a great one. Bye-bye.
Bye-bye.